Do you have upper back pain and stiffness in this region right here? Listen, you're not alone. There's a lot of people that have problems in this very area, and especially with the fact that we're sitting more than ever, we're on devices. This is a spot that's really hard to stretch, but I'm going to show you a few at the end of this video, 3 of my stretches to really target this area to make you feel better today. Do it yourself. My name is Tom Wellman. I'm from Apex Orthopedic Rehabilitation in Northern Jersey. Please subscribe to our channel down below right here. We go over some great educational videos. Every week we try and give you things that you can do at home or things to make better decisions regarding your healthcare. Or we want to see you live longer by moving better. All right, so let's go over a little bit of anatomy so we know what we're talking about here. I'm just going to name a couple spots. So we have the neck, cervical spine, which is the number C1 to C7. And then T1, which is the thoracic area, which is the first vertebrae that connects to the ribs, all the way down to T12. Then we have the lumbar spine, the kind of lower back issues, and our sacrum. So the area that we're talking about and we're trying to stretch is the thoracic region, okay? It's a very rigid area, actually, because of all the rib connections to this spot. So what could cause stiffness and pain in here? As we sit and we kind of forward bend, we typically lose the inability for the thoracic spine to straighten. So this is just our flexible model. So we typically adopt a more forward position, and this part of the upper back kind of loses its ability to straighten. So even if we want to straighten, we kind of get tight in that area. And the idea is it can cause some pain, stiffness, and problems in the thoracic. So that's just that area we talked about in here, all the way down to T12. So it's a large area. And we're going to go over some stretches to kind of loosen that up and make it feel a little bit better. So a couple things we got to keep in mind is occasionally we can have problems in this particular region. In actuality, it's coming from the neck. So sometimes we'll have people go through a couple neck movements called retraction, extension. We'll have them bend in all these directions. And we want to see if it reproduces any of the pain or stiffness in that area. If it really creates a lot of problems in this area, our problem actually might be occurring at the neck. Okay, so if you don't get results, you may have to address some neck issues in another video we have in our playlist that talks about my top 3 exercises for neck pain and stiffness. So just consider that. Most times shoulder problems won't refer to this area, okay, as much. So most likely if it's just in this focal area, you're probably not talking about a shoulder issue, okay? But you could be talking about a neck issue. So just consider that food for thought. Okay, next onto the exercise. Okay, so our first stretch we're going to do in sitting, okay? We're going to sit down in the chair here. A chair that's about this height, you know, is pretty good. It also varies on the person. Like I have a very large trunk, so I may need a little higher chair back for this, okay? I'll take that. Just for comfort, I'll take a little towel and I'll place it right at the point where I'm gonna put my upper back, the thoracic. So we're gonna scoot back and we're gonna lean against that point. We're gonna interlace our fingers like this, okay? Arms wide like this. You're simply gonna lean backwards. Pause, 1, 2, and then slowly come forward like that. All the way back, 1, 2, and then relax. You can do it 10 to 15 times. One thing that can help too is to get a good deep breath, like breathe through your nose and really get that breath so your lungs expand. Why do we want to do that? As we expand our ribs, those rib connections go right to the area that we're trying to stretch, okay? So it kind of helps with the stretch. So as we do it too, we want to consider that we can also use a stool. What we don't want to do is get to the point where we're arching the lower back, the lumbar area. We will get our foot up here, same stretch. Lean back, all the way back, pressure on, 1, 2, get a breath if you want. And then pressure off, okay? And that just limits the fact that you'll get more motion from the lower back. We want to get it from between where our hands are interlaced, you can see here, and where the roll contacts are the top. Using a towel, or we have some of these adjustable rolls you can do that you can inflate or deflate. If you want, send me a comment and I'll send you the link for this. And you can actually place a roll there. It's a little bit more gentle on the back. Okay, so that's our first stretch. The other stretch we're going to do in all fours. So we want to get the spine to arch, okay, which we were working on there, or what I call extend, so it gets a little straighter. The other thing that helps with arching or straightening out, I should say, is working on a little rotation. Rotation will also help us with this motion. So they're kind of combined motions. So we're going to work on a little rotation with the next stretch, which is a full form of a yoga stretch that I really like for the thoracic spine. So you're going to go down into all fours, like so. You want to have your legs about the wide width of your hips, your hands about the width of your shoulder, and you're simply going to start on one side. You're going to do this on the left and also the right. So you're going to bend the standing arm, the arm that you're on right here, and you're going to bend and rotate. 1, 2, and you want to view and look towards the hand that's moving, and then come up and view the hand as you come up. Try and keep it nice and straight, and then work on that, turning the head towards the hand that you're stretching. All the way over, and that'll create a great stretch to the thoracic, and then back again. You can do this 10 or 15 times. You can also switch. I like to do it on both. Switch on both. You may find, and most people have it, is one side is tighter than the other. Very normal, but we're going to work on it. So same idea, reach across, little pause, and then back up, okay? All right, now on to our third. The next stretch, our last stretch of the three that are great thoracic stretches, you're gonna lie actually flat. I got it from a physical therapist, Jeff Cavalier, just started using it, love it. So you're gonna lie on your stomach, hands out like so. Same idea, you're gonna almost be like a Y on the ground, okay? Both feet are gonna stay on the ground in a little wider position. You're essentially gonna take your hand, look towards the hand that's moving, all the way over, a little pressure, 1, 2, and slowly back down, okay? Same thing the opposite way, all the way over, right to the point of a stretch. This side's a little tighter for me. 1, 2, look towards your hand, turn your head and rotate. And I like, for this one, I like that nice alternating one. Nice and rhythmical, all the way over. 1, 2. One more time back. 1, 2. Okay. After a few weeks of doing this, 2 or 3 weeks, you should see a change in that comfort in that area, if that's the origin of the problem. Like I said, this could be coming from your neck, could be other things that are contributing to it, and just posturally, we tend to develop some of these patterns from what we're doing. So look at your seat position, look at your ergonomic setup as far as your computer workstation, and being aware of how long you're texting if there's an association. Listen, I hope this helps you out. Click and subscribe to our channel and learn about new topics that we'll be covering in the future. Our goal is to help you at our station to make you make better decisions regarding your health, okay, through natural movements.